of attention for good reason. Klonopin is the brand name for clonazepam,
Okay.
which is part of a family of drugs called benzodiazepines.
Okay.
And they act on the brain by amplifying the effects of GABA.
Yes.
GABA. It's a neurotransmitter that essentially tells the brain to slow down. So think of it like this. Imagine your brain's activity as a bustling city with traffic zipping around.
Yeah.
GABA is like the traffic lights, keeping things flowing smoothly.
Mm-hmm.
Klonopin comes in and makes those traffic lights extra long, really slowing things down.
So it's like hitting the brakes on your brain's activity.
That's a great way to put it.
No wonder it's used for anxiety.
Yeah.
It's literally chilling things out.
Yeah, very effective tool for conditions like generalized anxiety disorder or panic disorder, calming those racing thoughts and overwhelming feelings. It's also used to manage certain types of seizures by essentially hitting the pause button
Really?
on the abnormal electrical activity in the brain that causes seizures. But here's the important part. Klonopin is classified as a Schedule 4 drug.
Schedule 4. That sounds kind of serious. What does that even mean?
It's a classification system the government uses to categorize drugs
Okay.
based on their medical use and their potential for misuse.
Got it.
Schedule 4 means that while Klonopin has recognized medical benefits, there's also a risk of dependence and addiction, making it important to use it responsibly and under the careful guidance of a doctor.
So it's a bit of a double-edged sword then.
Exactly.
Helpful, but with potential for harm.
Yeah, that's why understanding those risks is so critical.
Okay, so let's talk about those risks then. What specifically makes a Klonopin overdose such a big concern?
There are a few key things that can lead to an overdose. The most obvious is taking more than the prescribed dose,
Right.
thinking if one pill helps, two will help more, which is absolutely not the case.
Right.
Another danger lies in mixing it with other substances, especially those that also depress the central nervous system.
Okay.
Things like alcohol, opioids, things like that. You're essentially stacking depressant on top of depressant,
Yeah.
which can quickly overcome the body system.
It's like adding weights to someone who's already struggling to carry a heavy load.
Exactly.
I can see how that could be a recipe for disaster.
It is. Unfortunately, it's a scenario we see far too often. The FDA has issued strong warnings about the dangers of combining benzodiazepines like Klonopin
Okay.
with opioids, as it can lead to serious complications like difficulty breathing, excessive sedation,
Wow.
and even coma or death.
That's incredibly serious. But wouldn't some people argue that having a drink or two while on Klonopin isn't really a big deal?
You might hear that.
Yeah.
But even small amounts of alcohol with Klonopin can be risky.
Okay.
Both substances amplify each other's sedative effects.
Oh, I see.
It's like adding fuel to the fire. What might seem like a mild effect individually can become much more potent and unpredictable when combined.
So no happy hour while taking Klonopin.
Probably not a good idea.
Got it. Now let's say someone suspects a Klonopin overdose is happening. What are the red flags to watch out for?
There are some telltale signs,
Okay.
but they can be subtle,
Yeah.
especially if you don't know what you're looking for. One of the first things you might notice is slurred speech. They're having trouble forming words clearly.
Right.
They might also seem confused, having difficulty concentrating or remembering things. It's almost like they're in a fog.
That sounds like it could be easily missed, especially in someone who's already anxious or like prone to forgetfulness.
It can be.
What else should we be looking for?
Keep a close eye on their breathing.
Okay.
Shallow or erratic breaths.
Mm-hmm.
Particularly if their breathing seems to be slowing down
Okay.
or pausing are major warning signs. You'll also likely notice problems with coordination.
Okay.
They might be stumbling, having trouble standing or walking straight.
Right.
And of course, if they become unresponsive or lose consciousness, that's a dire emergency.
So it's a combination of physical and mental changes.
Yes.
Let's say the worst happens and someone is showing these signs. What should people do?
The absolute first thing is to call 911.
Okay.
Don't wait. Don't hesitate.
Right.
Time is critical in an overdose situation. While you're waiting for the paramedics, try to keep the person awake and responsive if possible.
Okay.
If they're unconscious, check their breathing and be prepared to administer CPR if necessary.
So it's about taking swift action and doing everything you can to buy time
Right.
until professional help arrives. What happens when the paramedics get there?
Their primary focus will be on stabilizing the person's vital signs,
Okay.
making sure they're breathing and that their heart is functioning properly.
Right.
They'll administer oxygen, potentially use CPR,
Yeah.
and might even give medications to support heart function. There's also a medication called flumazenil that can sometimes be used in benzodiazepine overdoses.
Flumazenil, what does that do? Is it like an antidote?
You could think of it that way.
Okay.
It works by blocking the effects of Klonopin in the brain,
Gotcha.
essentially competing for those same receptor sites.
Okay.
It can help to reverse the sedation and counteract the dangerous effects of the overdose.
But not always used, right?
It's not always used, no, and has its own potential risks.
So it's a powerful tool in the right hands.
Yes.
But not a guaranteed fix.
Exactly. It's all about getting the person stable and managing the situation as effectively as possible.
This is all pretty heavy stuff, but, we're talking about life and death here. It's important to understand the gravity of the situation. But what about the aftermath? Let's say someone survives a Klonopin overdose. Are there long-term consequences, even if they seem to recover physically?
That's a crucial point.
Yeah.
And one that's often overlooked. Even if an overdose doesn't prove fatal,
Right.
there can be lasting damage, both physically and mentally.
What kind of damage are we talking about? Give us the hard truths.
One of the most worrisome consequences is brain damage due to oxygen deprivation during the overdose.
Oh, wow.
It can affect various cognitive functions, impacting things like memory, attention, and even personality.
So even if someone pulls through, their brain might not be the same. That's terrifying.
It's a harsh reality, but one we need to acknowledge. And it's not just the brain that's at risk. Other organs can also be affected, particularly the liver and kidneys, which are responsible for processing the drug.
So this really emphasizes the importance of prevention. What steps can people take to avoid a Klonopin overdose from happening in the first place?
The foundation is responsible use and open communication with your doctor. Sticking to the prescribed dosage, absolutely no self-adjusting or sharing medications, is paramount.
Right.
If you have concerns about your dosage or how the medication is working, talk to your doctor.
Yeah.
Never be afraid to ask questions or express your concerns.
So taking ownership of your health and being an active participant in your treatment.
Exactly. And it's essential to be completely honest with your doctor about any other substances you might be using, whether it's alcohol, prescription medications, or even over-the-counter drugs.
Gotcha.
They need the full picture to ensure your safety and make the best treatment decisions.
It's all about being informed and proactive. Knowledge is power, especially when it comes to something as potent as Klonopin.
You've got it. And remember, if you're struggling with substance abuse in general, reaching out for help is not a sign of weakness, it's a sign of strength. There are resources available, from treatment centers to support groups, that can provide guidance and support on the road to recovery.
Absolutely. Seeking help can be the most important step you take. It's about valuing your health and well-being above all else.
That's a great segue into what we'll discuss next. Now that we understand the potential risks, let's delve into the legitimate uses for Klonopin and explore why it's become such a widely prescribed medication. Knowing the benefits helps us understand the risks even more. Let's talk about what can go wrong when taking Klonopin, even as prescribed.
Okay, so we've talked about the dark side of Klonopin, the potential for misuse and overdose. But it's a pre-mislac of prescribed medication, so let's unpack the legitimate uses. What conditions is Klonopin typically used to treat?
Klonopin isn't inherently bad. It plays a valuable role in managing certain medical conditions. We've already touched on its use in anxiety disorders, like generalized anxiety disorder or panic disorder. For someone struggling with these conditions, the excessive worry, fear, and even panic attacks can be truly debilitating.
So in those cases, Klonopin could be a game changer.
It can be, yeah. It helps to calm the overactive circuits in the brain that contribute to these conditions. But it's not usually the first line of treatment. Doctors often try other therapies like cognitive behavioral therapy or other medications first.
Makes sense. You wouldn't want to jump to a medication with potential risks if there are other effective options. You also mentioned seizures earlier. How does Klonopin help with those?
Think of it as a circuit breaker for those electrical storms in the brain. Klonopin is used to manage certain types of seizures, such as Lennox-Gastaut syndrome and absence seizures. It works by calming that abnormal electrical activity that causes seizures. Essentially, it helps to stabilize brain activity and reduce the frequency and severity of seizures, which can dramatically improve quality of life for individuals with these conditions.
So it's like a safeguard against those electrical surges that disrupt normal brain function. It sounds like Klonopin has a significant role to play in managing these serious conditions. But I imagine there's also a flip side, even when taken as prescribed. What are some of the potential downsides or side effects that people should be aware of?
You're absolutely right. No medication is without its potential side effects, and benzodiazepines, including Klonopin, are no exception. One of the most common side effects, which makes sense given that it's a central nervous system depressant, is drowsiness. People taking Klonopin might experience dizziness, fatigue, and slowed reaction time. This is why it's crucial not to drive or operate machinery while taking Klonopin, at least until you know how it affects you.
That's interesting. It reminds me of those warnings you see on cough syrup bottles.
Exactly. It's there for a reason, safety first. Other common side effects include impaired coordination, memory problems, and confusion. In some cases, people might experience mood swings, irritability, or even depression, which seems counterintuitive for a drug designed to alleviate anxiety.
That is paradoxical. It makes you wonder how much we really understand about the brain and how these medications interact with its complex chemistry. So a drug meant to ease anxiety might actually worsen mood in some cases.
It highlights the delicate balance within the brain and the fact that medication affects everyone differently. It's also crucial to be aware of potential interactions with other medications. Always inform your doctor about all the medications and supplements you're taking, even things that seem harmless, like over-the-counter pain relievers or herbal supplements.
That's a good reminder for any medication, really. Full transparency with your doctor is key. We've touched on side effects, but let's address the elephant in the room: addiction. Is that a serious concern with Klonopin?
Yes, unfortunately it is. Benzodiazepines, including Klonopin, have the potential to be habit-forming, especially with prolonged use. Even if someone is taking it exactly as prescribed, they could still develop a physical dependence.
So their body starts to rely on the drug to function normally.
That's right. Over time, the brain adapts to the presence of the drug, and when you try to stop taking it, you can experience withdrawal symptoms, which can be quite unpleasant and even dangerous.
We've talked about the physical dangers of overdoses, but what about the psychological effects? Can a Klonopin overdose mess with your mind?
Absolutely. Remember, Klonopin is a powerful psychoactive drug, meaning it affects how your brain functions, including your thoughts, emotions, and behavior. During an overdose, the inhibitory effects are amplified, leading to a range of psychological effects.
Like what? Paint us a picture.
Imagine a feeling of overwhelming confusion and disorientation. Your thoughts are scrambled, your memories are fuzzy, and you're struggling to follow conversations. You might even experience paranoia, hallucinations, or delusions. Your perception of reality becomes distorted.
That sounds terrifying and incredibly isolating.
It can be. It often goes hand in hand with feelings of fear, anxiety, and panic, adding another layer of distress to an already overwhelming experience. In some cases, people might become aggressive or violent, making it crucial to seek immediate medical attention.
So it's not just the physical dangers, but the potential for a mental and emotional roller coaster as well.
Precisely. A Klonopin overdose can have a profound impact on both your body and your mind. And even if someone survives the initial overdose, there can be lingering psychological consequences.
Lingering consequences? What do you mean?
Well, imagine going through an experience so intense and disorienting that it leaves a lasting mark on your psyche. Some people might develop post-traumatic stress disorder, PTSD, as a result of the overdose, especially if it was particularly traumatic or involved a near-death experience.
So the trauma of the overdose could leave emotional scars.
Unfortunately, yes. And those scars can manifest in a variety of ways: flashbacks, nightmares, anxiety, even avoidance behaviors. It's like the experience, even though it's over, continues to cast a shadow over their lives.
And what about the cognitive effects we talked about earlier? Could the potential for brain damage lead to long-term problems with thinking and memory?
It's definitely a possibility. Oxygen deprivation during an overdose can damage brain cells, particularly in areas responsible for memory, attention, and executive function.
So someone might have trouble remembering things, concentrating, or making decisions, even after they've physically recovered from the overdose.
That's right. And these cognitive impairments can have a significant impact on their daily life, their work, their relationships, their overall well-being. It's not just about bouncing back physically, but also mentally and cognitively.
This paints a pretty stark picture of the potential long-term consequences. It really highlights the need to take this seriously and understand that the effects can extend far beyond the immediate crisis.
Exactly. It's about recognizing the complexity of the issue and approaching it with a sense of gravity and compassion. Recovery from a Klonopin overdose can be a long and challenging journey, and it's essential to seek professional help to address both the physical and psychological aspects.
Okay, we've been talking specifically about Klonopin, but it's just one example of a larger class of medications known as benzodiazepines.
Yeah.
What can you tell us about this broader category drugs?
That's an important point. Klonopin is just one piece of the puzzle, and it's helpful to understand the bigger picture. Benzodiazepines are a class of psychoactive drugs that act as central nervous system depressants. Essentially, they slow down various brain functions, including those involved in mood, sleep, and cognition.
So they essentially chill out the brain.
That's one way to put it. They work by enhancing the effects of GABA, which we talked about earlier, that neurotransmitter that inhibits brain activity. By boosting GABA's effects, they create a sense of relaxation, calmness, and reduced anxiety.
Okay, besides Klonopin, what are some other common benzodiazepines that people might recognize?
You might have heard of Xanax, alprazolam, Valium, diazepam, Ativan, lorazepam, and Restoral, temazepam. They all belong to the same family of drugs and share similar mechanisms of action, although they vary in their potency, duration of action, and specific uses.
So it's like different flavors of the same ice cream. They all share the same base, but with subtle variations.
That's a good analogy. They're commonly prescribed for a range of conditions, including anxiety disorders, panic attacks, insomnia, seizures, muscle spasms, and alcohol withdrawal.
So they have quite a broad range of applications.
They do, but it's important to remember that they all carry similar risks, including the potential for dependence and addiction, as well as side effects like drowsiness, impaired coordination, and memory problems.
So it's not just Klonopin we need to be cautious with, but the entire benzodiazepine family. What are some of the warning signs that someone might be developing a dependence on these drugs?
One red flag is needing higher doses to achieve the same effect, which is a classic sign of tolerance. Another is experiencing withdrawal symptoms when you try to stop taking the medication. Your body is essentially rebelling against the absence of the drug. And perhaps the most concerning sign is continuing to use the drug despite negative consequences, whether it's relationship problems, job loss, or health issues.
So it's a slippery slope that can lead to serious consequences if not addressed.
It's a complex issue, and it's important to approach it with a balanced perspective. Benzodiazepines can be valuable tools in managing certain medical conditions, but they need to be used with caution and under close medical supervision.
So it's about weighing the potential benefits against the potential harms.
Exactly, and it's about recognizing that these are powerful drugs that can have significant impacts on both the body and mind.
We've talked about the individual effects of benzodiazepines, but what about their impact on society as a whole? What are some of the broader social implications we need to consider?
That's an important question, and it's one that often gets overlooked. The social impact of benzodiazepines is multifaceted and far-reaching, with implications for healthcare systems, law enforcement agencies, families, and communities. One of the most obvious starting points is the economic burden. Benzodiazepine misuse and overdose place a significant strain on healthcare systems, law enforcement agencies, and social services.
How so? Break it down for us.
Think about the costs associated with emergency room visits, hospitalizations, addiction treatment, and lost productivity. These costs add up quickly, diverting resources from other areas and impacting everyone.
So it's not just about individual health, but also the health of the economy as a whole.
Exactly. And beyond the economic impact, there's the social and emotional toll. Benzodiazepine misuse can lead to relationship problems, family breakdowns, and social isolation. Imagine the strain it puts on families, the damage to relationships, the impact on children.
So it creates a ripple effect that extends far beyond the individual user.
Absolutely. And we can't forget about the impact on communities as a whole. Communities grappling with high rates of benzodiazepine misuse often experience increased crime rates, homelessness, and a decline in the overall quality of life.
It sounds like a web of interconnected issues that are difficult to disentangle.
It's a complex problem with no easy solutions. Addressing the social impact of benzodiazepines requires a multi-pronged approach that involves education, prevention, treatment, and support.
What would that look like in practice? What are some concrete steps we can take?
We need to raise awareness about the risks associated with these drugs, both for those who prescribe them and those who might take them. Doctors need to be mindful of prescribing practices, ensuring that benzodiazepines are only prescribed when truly necessary and for the shortest duration possible. And patients need to understand the potential risks, the importance of following dosage instructions, and the dangers of mixing benzodiazepines with other substances.
So it's about fostering a culture of responsible prescribing and responsible use.
Exactly. And it's about recognizing that addiction is a disease, not a moral failing. We need to create a society where people feel comfortable seeking help without shame or judgment.
Okay, so education and awareness are key. But what about treatment? What options are available for people who are struggling with benzodiazepine addiction?
That's a great segue. Let's dive into the world of treatment and recovery in the next part of our deep dive.
We've talked about the dark side of Klonopin and the larger family of benzodiazepines, the potential for misuse, the risk of overdose, the social and economic impacts. It's a lot to take in.
Yeah, it is.
But let's shift gears and focus on a more hopeful aspect. Treatment and recovery.
Right?
What does that journey look like for someone struggling with benzodiazepine addiction?
It's important to remember that recovery is possible.
Okay.
Benzodiazepine addiction is a serious condition,
Right.
but it's treatable
Okay.
with the right support. Individuals can overcome addiction,
Mm-hmm.
reclaim their lives,
Yeah.
and achieve lasting well-being.
That's reassuring to hear.
Yeah.
But what does treatment actually entail? It sounds like a daunting process.
It can be,
Yeah.
but it's a journey worth taking. Treatment often involves a multifaceted approach
Okay.
that addresses both the physical and psychological aspects of addiction.
Gotcha.
One of the first steps is typically medical detoxification, which involves safely managing withdrawal symptoms as the body clears itself of the drug. We've talked about how those withdrawal symptoms can be pretty intense, so medical supervision is crucial, right?
Absolutely. We've heard about the tremors, the anxiety, the potential for seizures. It sounds incredibly difficult to go through alone.
You're right. Detoxing from benzodiazepines should always be done under the care of qualified medical professionals.
Yep.
They can monitor vital signs,
Mm-hmm.
provide medications to alleviate discomfort,
Yeah.
and intervene if any complications arise. It's not something to try at home on your own. Cold turkey withdrawal can be dangerous, both physically and mentally.
So detox is the first hurdle.
It is.
What happens after the body is clear of the drug?
That's when the focus shifts to addressing the underlying psychological
Okay.
and behavioral aspects of addiction.
Got it.
This is where therapy comes in.
What kind of therapies are typically used in this context?
There are a variety of evidence-based therapies that have proven effective in treating benzodiazepine addiction. One of the most common is cognitive behavioral therapy, or CBT.
CBT, I've heard of that.
Yeah,
Doesn't it involve, like, identifying and changing negative thought patterns?
that's the heart of it.
Okay.
CBT helps individuals identify and modify negative thought patterns and behaviors that contribute to their addiction.
Gotcha.
It's about recognizing those triggers that lead to cravings
Okay.
and developing healthier coping mechanisms.
Mm-hmm.
It also equips individuals with the skills to manage stress, cravings, and challenging situations that might tempt them to relapse.
So it's about rewiring the brain to break free from those addictive patterns.
You could say that. It's
Yeah.
about empowering individuals to take control of their thoughts, their emotions, and their behaviors.
What other therapies are commonly used in benzodiazepine addiction treatment?
Another effective approach is motivational interviewing, or MI.
MI.
Yep. It helps individuals explore their ambivalence about change
Okay.
and strengthen their motivation to recover. It's a gentler, more collaborative approach that respects the individual's autonomy
Okay.
and empowers them to make positive choices.
So it's about tapping into their own inner drive to get better, rather than like forcing them into a particular mold.
Exactly. It's about helping them find their own reasons for wanting to change
Yeah.
and supporting them as they navigate the ups and downs of recovery.
We've talked about individual therapy, but what about the power of group support? Do support groups play a role in the recovery process?
Absolutely. Support groups like Narcotics Anonymous or NA
Right.
or Smart Recovery
Mm-hmm.
can be invaluable. They provide a safe and supportive environment for individuals to connect with others who understand their struggles.
Okay.
It's about sharing experiences,
Yeah.
offering encouragement, and holding each other accountable.
There's something powerful about realizing you're not alone in this struggle, isn't there?
It can be life-changing. Knowing that others have walked this path and come out the other side can instill a sense of hope and possibility.
We've talked about therapy and support groups, but are there any medications that can help in the treatment of benzodiazepine addiction?
In some cases, medication-assisted treatment, or MAT,
Okay.
might be used in conjunction with therapy and counseling.
Gotcha.
Certain medications can help reduce withdrawal symptoms, manage cravings, and decrease the risk of relapse.
Mm-hmm.
It's like providing a safety net while the individual works on the underlying psychological and behavioral issues.
So it's about using medication to help manage the physical aspects of addiction,
Right.
while therapy addresses the root causes.
That's a good way to think about it. It's a comprehensive approach
Right.
that recognizes the complexity of addiction.
Mhm.
But it's important to remember that MAT is not a quick fix or a magic bullet. It's just one piece of the puzzle, and it should always be used as part of a comprehensive treatment plan that includes therapy and support.
Okay, so we've covered a lot of ground here. We've talked about the dangers of benzodiazepines, the risks of overdose, and the complexities of addiction. But we've also explored the pathways to recovery, the importance of seeking help, and the power of human resilience. As we wrap up this deep dive, what's the key takeaway message you want to leave with our listener? What's the most important thing for them to remember?
If you are struggling with benzodiazepine use or addiction,
Yeah.
please know that you're not alone.
Right.
There's no shame in asking for help.
Mm-hmm.
Reach out to a trusted healthcare provider, a therapist, a counselor, or a support group.
Okay.
There are people who care, who understand, and who want to help you heal.
Yeah.
Recovery, possible.
Right.
Might be a long and winding road,
Mhm.
but it's a journey worth taking. And you don't have to walk it alone.
Beautifully said. And remember, knowledge is power.
It is.
The more you understand about benzodiazepines, the better equipped you'll be to make informed decisions about your health and well-being. Thanks for joining us on this deep dive. We hope you found it informative and empowering.
It was my pleasure.